Oh, that's backwards. Switch sides there. Nope. It's weird that it's in presentation mode. Let's try it this way. There we go. How's that? A little bit better. Okay. Yeah, so my project is titled Urban Tree Characteristics Modify the Association Between Temperature and Mortality. This is my first paper for my PhD, and we are just about to publish it. Hopefully, we're about to submit it phase right now. So I'm just going to go back to the slide there. So again, my committee is Dr. Daniel Ranham and Dr. Christopher Green, Matilda Vanden Bosch, and then these other three individuals were involved as well, and they helped extract some of the LiDAR information that we're going to be using, some of the tree characteristics that we used in the study. So just a little bit of background. I'm sure you guys know a lot of this, but I'll do it anyways. High ambient temperature is associated with increased risk of mortality. So we see higher rates of mortality due to cardiovascular stress and heat stroke and respiratory mortality. We also see just generally non-mortality based health outcomes such as heat exhaustion and this type of thing. One of the issues that we have, and it's actually been covered in the previous presentation, is that we have climate change. We're facing climate change, and that is going to see increases in mean temperatures throughout all North America. We're going to also see more extreme weather events, more frequent weather events. We're also going to see more prolonged extreme weather events, which can see higher temperature exposure in larger populations of people for longer periods of time. And one of the issues as well is that we have an increasing urban population worldwide. So not just in Canada, but we have this happening worldwide. So what's happening is that we're having more and more people being exposed to extreme temperatures. And in this study, we looked at the effect of urban trees and how they're able to potentially lower surface temperatures and air temperature. There's a lot of research that's already been carried out to demonstrate that urban trees actually lower surface temperatures by providing shade, for example, but they're also able to reduce air temperature in the area, ambient temperatures through evapotranspiration and also shading as well. So there might be a kind of a neighborhood or regional effect to this cooling rather than just specifically shade right in the immediate area, which could then provide kind of a protective barrier against heat-related events, which is really nice. One of the issues, though, that we have is that we have a competing need in cities for urban densification and greenification. So to address urban sprawl, we're seeing a push for urban densification, and which also would increase accessibility, and there's a lot of other benefits to it as well. But at the same time, there's a lot of research showing that greenification is important. So we need this for overall mental health and well-being, improving exercise in populations, and of course, decreasing the impacts of climate change. So we have two competing needs there. So there's a need for research that looks at a few different things. Specifically, we need to better understand the specific role of trees on heat-related mortality. So a lot of research shows that trees decrease temperature, which is wonderful, but does that actually translate into an impact on mortality rates or mortality cases or risk of mortality in the case of this study? We need to better understand what is the optimal tree type and canopy characteristics. The reason we need to do this is because, as I mentioned before, we have that competing need for urban densification and greenification. So, you know, it's not prudent to just say we need more trees. We're going to plant more trees because that's going to fly in the face of, for example, densification. So we need to figure out, you know, what is the best amount of trees, or what is the best type of trees, or what is the characteristics of the canopy that we should be aiming for, that we can decrease these mortality rates or risk of mortality via temperatures while not flying in the face of some of our needs for densification. And we need to understand just what the threshold is. So again, a lot of times it's, you know, more trees equals better, obviously, but is there a threshold where there's a protective effect as actually occurs? So, you know, do we need 75% canopy cover? Do we need 30% canopy cover? What is the threshold? And then that's a goal that we can shoot for in policy and planning. So I had two primary objectives in this research. The first one was to just investigate the association between daily temperature and mortality. And this was carried out for Montreal and Ottawa and Toronto in Canada. And we are going to eventually hopefully expand this to other cities as well. But these are the first three that we have because we have really good tree data for these cities. So to carry out this analysis, we employed what is called a case crossover design. Anyone who does epidemiology probably knows this. In a case crossover design, each person acts as their own case and their own control. So rather than comparing individuals to other individuals, which is what's done typically, which can be very challenging, we use the case crossover method, which can help tease out some of the individual, or help eliminate some of the individual effects that could be different between different cases, which is really nice. So what we do is we compare the day that the person actually passes away, which is the case day, and all of the control days for that specific individual are the rest of the month. So for example, if they died on a Monday in February, the other 3 Mondays of that same month are used as control dates, which is cool. Here we go. And the reason that we used day of the week for this time stratified case crossover analysis is that there is a bit of a day of the week effect where people, for example, are more likely to pass away on a Monday due often to stress than, say, for example, a Friday. So it's important to also factor in the day of the week as well. So we don't just use, the previous 4 days or the previous 5 days. We actually use the same day of the week throughout the month. The second objective was to then factor in tree canopy. So I mentioned that before. We're going to be using tree canopy and tree number and Ndvi. So we wanted to then see what is the moderating or protective effect of these tree canopy characteristics if we apply them to each individual. So all of the mortality cases were assigned, mortality and control cases were assigned one of 4 quartiles of each tree variable. We had a lot of tree variables. And they were assigned one of each 4. And then we ran the analysis again to see if there was a protective effect of people who are, for example, in the highest quartile versus the lowest quartile. So I'll just go over some of the data in the study area. So as I mentioned, it was Montreal, Ottawa, Toronto. Actually, we didn't use Vancouver for the study, unfortunately, because the tree data was not comparable. So Vancouver was not used in this case. And so we had all-cause mortality between 2001 and 2015 for the 3 cities. Which we then narrowed down to cardiovascular and respiratory deaths. And that was based on ICD coded cause of death. So I went through and I basically extracted non-cardiovascular respiratory deaths. These were all coded to the postal code of residence or mailing address. That's just how the data is supplied from the health professionals. So basically, each person has their postal code. It doesn't unfortunately tell us whether it is their mailing address or the residence. That's just, when you go to the doctor and it's recorded, that is how it's supplied, which I'll go into that a little bit in a moment, but that is how it's supplied. So each postal code has the cases there. The exposure data was Environment Canada weather data. We used daily mean temperature for this, and it's supplied at what I would describe as a blanket temperature. So it's collected at the airport in most cases, and then we extrapolated that to the whole city. That's typically how it works when you look at weather data. There's benefits and disadvantages to that, which I'll talk about in the future as well. But that's what we used for this first study, the primary study. The tree data, we had LiDAR, which is high resolution, remotely sensed imagery. We had that collected for all 3 cities on different dates, Ottawa, Montreal, and Toronto in 2017, 2015, and 2008, respectively. This was collected at 0.6 meter resolution, so it's considered quite fine resolution imagery. And the cool thing about LiDAR is that it's able to actually capture the characteristics of the trees and the tree canopy. So you can get tree heights, you can get tree canopy volume, area, number, the specific location of trees, etc. So it gives you a lot of detail there. And the group extracted several different variables. We narrowed down by using correlation matrices that mean tree canopy area, mean tree canopy volume, and total number of trees were the variables that we used in this analysis because they were able to explain the other variables more effectively. And these were then aggregated to postal codes. So there's different administrative boundaries that you could use for this type of analysis. Because we had mortality cases at postal code, we did the same. So we aggregated out to 4 different buffer distances: 100 meters, 250 meters, 500 meters, and 1,000 meters. So we could look at the, for example, mean tree canopy area within 100 meters of that mortality case. And then we could look at mean tree canopy area within 250 meters of that and kind of see what the neighborhood tree characteristics are like for each mortality case. We also included NDVI data, which is normalized difference vegetation index, which is, if you're not a remote sensing person, is essentially giving you, it's a indices that's giving you the general health of vegetation in the area. So it can measure it can give an example of whether there's trees or vegetation present and whether they're healthy. So it's kind of an indices that is used typically in research. It's a coarser resolution of 30 meters, so you can't necessarily identify individual trees. You can't necessarily even identify that there's trees versus bushes, for example, but it does give you an overall example of what is going on in terms of vegetation in that area. And that was used specifically because a lot of research does use NDVI with surface temperature. So we wanted to incorporate that as well. And NDVI data is readily available, whereas LiDAR is not necessarily readily available. It comes in, has to be actually flown, and it's not available day over day. Whereas NDVI, you can typically have for several, you can have several surfaces or NDVI surfaces for example, for each summer, which was really useful. So this is how we prepared the data. We had all-cause mortality for the 3 different cities: Montreal, Ottawa, and Toronto. And then I had to remove the institutional addresses. So I mentioned before that they were just coded to postal code of potentially mailing address or living address. We don't really know necessarily. And the reason it was initially flagged is we have PO boxes in there. So someone who's done geocoding before, I said, hey, these are PO boxes. People don't live in their PO box necessarily. I mean, maybe they do, but it's unlikely. So we need to remove those because that doesn't reflect where the person was potentially exposed to the high temperatures. It doesn't reflect, specifically in our case, what the tree characteristics were in their neighborhood, because again, they don't live in their postal code, in their PO box. So those were removed out. I used the Statistics Canada PCCF postal code conversion file, which you can then, it does identify the type of address, and it will flag PO boxes and institutional addresses, which I can then double check and then remove. So we removed all of those. So we had most likely where people live, or at least their their actual address that they recorded where they live. And then we selected summer months. So we didn't want to use cold weather in this specific case because we're looking at heat-related mortality, not specifically the effect of trees in moderating extreme cold, which they may still affect, but that's not the focus of this study. So we focused on May through October. I looked at the different temperature data. That is where you can have potentially extreme high temperatures throughout the day. After October, it becomes less likely that you're going to have days above 21 degrees Celsius, at least in Canada. So considering these were Canadian cities, that's the range that we used. And then we linked them with tree data. So not all cases in our mortality data set had tree data available based on just where the LiDAR was flown. LiDAR it actually has to be flown, and it's not necessarily at a whole area. So for example, in Toronto, the mortality case is extended outside of the city of Toronto proper in our database, but we only had LiDAR data for the city of Toronto proper. So we didn't use any of the surrounding data. So it was narrowed down a little bit further. So for the first objective, to look at the relationship between mortality and temperature, we did want to look at, figure out the lag effect, the lag influence on mortality. So typically there is an accumulation effect on mortality when people are exposed to extreme heat. So day after day, if you're exposed to more and more extreme heat, you're more likely potentially to have an event, which is potentially mortality or some other extreme health outcome. So we ran this analysis to look at the lagged effect, and because I need to know which day we were going to use specifically to look at for temperature. And it was actually found that the highest risk is the day of actual exposure. So yes, the day before does potentially have somewhat of an impact on the risk of mortality, as we can see on the bottom of the x-axis there. By the second day out, so 2 days before, it no longer is significant. So really the primary effect is observed on the actual day of exposure. So we decided, okay, we're going to look at day of exposure as the primary in our case crossover. And this is one of the results. I have a lot more results, but we narrowed them down to kind of just something for visual purposes here. So on the left here, we have the relative risk on the y-axis, and then we have the temperature on the x-axis. So as you can see, at the lower temperatures, the risk of mortality is lower. As we go up in temperature, once we hit about 21 degrees Celsius, we start to see increasing risk of mortality as temperatures continue to rise. And so as some examples here, we have the mean daily temperature of 21 degrees. At 21 degrees, that's where relative risk exceeds 1. So anything above 21 degrees, you're going to be more likely to see mortality cases in those temperature days. And so you can see there in the center column, the days that were observed at 21 degrees, this is for all 3 cities, were 12.24% of all days in the data set. However, that accounted for 32.17% of all mortality cases. So we can already see a discrepancy there where the warmer days are, I guess, equally distributed, 12.24%, but we see almost 3 times the expected mortality cases on that day, on that temperature. 26 degrees is where we see a relative risk of 0.05, which is a 5% increase in risk of mortality. And we had only 1.39% of days at that temperature, but almost 4% of mortality cases were observed at that temperature or above. And then the final one is 29 degrees. We selected 29 degrees because that is where we see a 10% increase in mortality. And it was only 0.08% of days that occurred at that temperature. So not very many. I mean, it's Canada, it's not that hot, at least not yet until climate change comes in. But we saw 0.28% of mortality cases. And this is important because one of the things that, one of the projections that we see with climate modeling is that we're not necessarily only going to see overall max temperatures going up. The extremes are going to be pushed obviously up a little bit, but what we are going to see is that there are more extreme temperature days. So whereas in this data we only had 14 days at 29 degrees, under climate change models potentially we have dramatically more days at that extreme temperature of 29 degrees. And this is this doesn't factor in humidex, this is raw temperature. And so then we're going to potentially see excess deaths. So anything, then we can then predict, okay, what are the excess deaths we would see once we hit 29 degrees, which is important to understand. So here is some of the results for objective 2. These are just some selected interesting graphs that I wanted to show you guys. So this one here is for the city of Montreal, and it's looking at 100-meter buffer distances. So fairly neighborhood oriented buffers. That's about the size of a postal code approximately. And we're looking at mean tree canopy area. So one of the different variables. And we can see here on the graph that at 21 degrees Celsius, there is really not necessarily any moderating effect from trees, but that's also because there isn't really an increased risk. That's where we saw, that risk value kind of just starts to go up. So in all 4 tree canopy quartiles, so the 4 different lines of bar graphs, it's around 1, so it's not really elevated. When we move to 26 degrees, however, you can see that there is an increased risk of mortality, specifically in the lower quartiles. So in the lowest quartile, we're up quite a bit, around 1.3. And then as we increase the tree canopy quartile in this case, so mean tree canopy area, the risk of mortality decreases. So we're getting a moderating effect. And in the highest quartile, which is the last one there under 26 degrees, you can see that we've actually dropped below a relative risk value of 1. So we're actually seeing a moderating effect where risk of mortality is actually decreased under those highest tree canopy. And again, when we go up to the highest temperature here, so 29 degrees, the most extreme temperature, we see an even more pronounced effect. So the highest temperature people now have an even higher risk of mortality, but we see an even more dramatic moderating effect in that highest tree canopy quartile, where it's dropped down quite a bit. Now this is only one example at 100 meters. This trend was exhibited across all 3 cities. And we'll go on to the next one here. So for here, we are looking at the 3 different cities. And this is specifically looking at the same variable. So mean tree canopy area at 100-meter buffer. And we can see here that in Montreal, we have that moderating effect, as I mentioned before. So we see that at 29 degrees, the highest quartile of tree canopy area, there is a protective effect. This same effect was seen in Toronto as well, where it's dropping down to just slightly below a relative risk value of 1 in the highest canopy quartile. So again, we're seeing the same protective effect in Toronto as we saw in Montreal. Now in Ottawa, we did not see. The data looks a little bit funky, you can see there, where it actually potentially goes up, but those arms in the bar graph show that it's just not significant. Part of this is actually because in Ottawa, we have very few days at these extremes of 29 degrees. It's just not as hot of a city. And so the ability to reach significance is just not there. So that's one of the confounding factors when you get to Ottawa and the highest temperatures. Another thing that we noticed is that when you look at spatial analysis, spatial distribution of tree canopy, there's actually more even distribution of trees throughout Ottawa than there is in Montreal and Toronto, which can see more people being exposed in Montreal, Toronto to areas with lower canopy variables, whereas in Ottawa, there is just more people potentially in vegetated areas. So that's important to understand as well. And in this graph here, we are showing the 4 different tree canopy or tree variables that I mentioned before for the same city. So this, again, we're just using Montreal here for this example. And it is 100-meter buffer again. And we're showing 2 different temperatures. So we're showing 21 degrees Celsius versus 29 degrees Celsius. And we're showing this for mean tree canopy area, the total number of trees, mean tree canopy volume. So those 3 are all derived from the LiDAR data. And then we also included here the mean Ndvi, just to see how that compares as well. So you can see here that canopy area, again, 21 degrees, we have a relatively low risk of mortality. Once we move to 29 degrees, there is a moderating effect where those dramatically increased relative risk values are brought down in the 4th quartile. We see that exact same type of trend in total number of trees. Some research suggests that just counting trees is great, but in some areas trees could potentially be younger and smaller and have smaller canopy area, potentially in, for example, subdivision areas. So it is important to separate the two, that mean tree canopy area isn't necessarily going to be associated with total number of trees, depending on the age of the neighborhood, the type of trees that are present as well. But we did see the same effect with total numbers of trees as well. Part of that is that these 3 cities, the areas we were looking at, were older neighborhoods, generally speaking. What's interesting is if we expand this out with more data and potentially look at subdivisions, for example, or fringe areas where we see newer development, are total number of trees still associated with this moderating effect? Potentially not. If the trees are young, it could take years before we start to see this moderating effect. As the trees grow up, get a larger canopy area, we start to see a protective effect. So a lot of these sprawl areas might actually be significantly more vulnerable, potentially. We'd have to look at that. That's kind of one of the next things we're going to look at. And then if you look at mean tree canopy volume, as expected, it's going to be this same type of effect as area. And then the 4th one here is the mean Ndvi. So generally speaking, as we look at this, more vegetation is good. So if we have more vegetation in an area, more healthy vegetation in an area, there's a protective effect. Where the lowest 3 quartiles, there is elevated risk and people are not being protected. As we move into that 4th quartile, there's a protective effect from Ndvi as well. So that's really good because we can compare that to a lot of different studies that use Ndvi and surface temperatures to say, okay, there is a protective effect here. And here's the last graph for today. And this was just looking at those buffer distances. So I mentioned before, we had 4 different buffer distances we aggregated the tree variables to: 100 meters, 250 meters, 500 meters, and 1,000 meters. And I just wanted to know, is there a neighborhood or a localized effect of these variables? So 100 meters is roughly the size of a postal code, at least in our study areas, depends where you are, but in Toronto, Montreal, and Ottawa, there is a approximation between 100 meters and the postal code size. And yes, obviously there is, as I mentioned before, a protective effect. So as the tree canopy variables go up and the total number of trees and Ndvi go up in your postal code, basically in your neighborhood, there is a protective effect. If we extend that out to 250, 500, and 1,000 meters, that effect is still there, but it starts to drop down a fair bit, especially in that fourth quartile. So this suggests that there is actually a neighborhood effect on the temperature mortality relationship, where it's not necessarily that, okay, we have more trees in the city, therefore we're protected, which is still potentially true, but there's actually a protective effect directly in the surrounding area around where these higher tree areas are. So this speaks a lot to neighborhood effects on mortalities and the need for potentially having better tree variables and better tree canopy characteristics in neighborhoods, specifically higher risk neighborhoods as well. So just a bit of a discussion here. We showed that exposure to high ambient temperatures is associated with increased risk of cardiorespiratory related mortality in the 3 cities. That was to be expected, but we validated that. We did show that this effect is strongest on the day of mortality. So these extreme spikes in temperature, even for one day, are enough to potentially increase the risk of mortality enough where we see excess cases. And this drops down as several days go out too. So that's important for the way that we run these models as well, not just for the overall effect, but the way that we run these models is very important to know which days we should isolate. We also showed that the odds of mortality are decreased, specifically the odds of mortality from heat exposure are decreased in areas with the highest quartiles of tree canopy characteristics. So as there's higher amounts of mean tree canopy area, volume, total number of trees, and NDVI, there is a protective effect against the temperature-related mortality in cardiovascular and respiratory cases. And there is that localized effect. So this basically suggests that we need to better understand what are the localized effects, and then potentially that can inform policy going forward. So the future direction, which is essentially my subsequent papers for my PhD and hopefully research going afterwards, is to determine what is enough tree canopy area. So as I mentioned in the very beginning, it's kind of, it's tempting to just say, well, we need more trees. I mean, obviously we need more trees. There's lots of benefits for that for climate change in general, but also protective effects and therapeutic effects for people who are out exercising. And there's a lot of research on that already, but it's not basically feasible to say, we're just going to plant the maximum number of trees in every single city, especially when we have urbanization worldwide, where more and more people are moving to cities. We have increasing populations in these cities, and potentially we have increasing density, which we actually need to address issues of accessibility and just housing, getting people into cities, affordability, all these different things, and not having dramatic sprawl at the edges of cities that takes up farmland and takes up other natural spaces as well. So we have that competing, we have those two competing goals there. So we need to know what is enough tree canopy to meet the needs, the protective effects that we need in the face of climate change. So going forward, we need to, for my next paper, I'm going to isolate more spatially resolved temperature data. So as I mentioned, we had airport data, which is typically what most research uses if they don't have access to better data. So that's going to be blanketed throughout the city. But the problem is we have inter-neighborhood variation in temperature that we weren't able to capture in this specific study, which would be affected by typically by land cover. So if you have more permeable surfaces, buildings, large buildings, parking lots, you're going to have higher temperatures. And if you have more vegetative surfaces, more permeable surfaces, more canopy over top, you're going to have lower temperatures. So it's important for us to actually get that into the next analysis. It's a bit challenging to do that because you have to, this data is not collected at the inter-neighborhood level. There are some resources we can use, such as Weather Underground, where people collect weather data themselves, and you can make a spatially interpolated surface and get those variations in temperature throughout a city. Or in my case, we're going to be employing more remote sensing, where we can actually use satellite imagery to extract temperature surfaces for each city. So we can look at about a 30-meter resolution throughout the city. What are the surface temperature values? It's a little bit different than getting air temperature, but it is an approximation that can be used well for trees because of the shading effect that trees offer. So that's surface temperatures. We do want to also improve the temporality of tree data, and that's not just for this research, but research in general. LiDAR data is great because it's really fine resolution, sub-meter. You can actually see the characteristics of trees, but LiDAR information is not available for every place in the world, and it's certainly not available for different time slices. So you have, maybe if you're lucky, a few times every decade you'll have LiDAR data, unless you're flying it yourselves. So we want to know, what are the changes in trees over time. So we're going to try to find more, temporally sensitive data as well. And potentially we're going to have to be using more satellite imagery as well, which is one of the reasons we use that NDVI in our analysis, because we do want to know if, the satellite imagery that is freely available for basically the entire planet, if that's enough, if that's capable of capturing this effect. And in our case, it is to some degree. So we may be using NDVI going forward, just so that we can have that temporal sensitivity that LiDAR information lacks, which is kind of the gold standard, but it's a gold standard, so not everybody has it. And then potentially what we can do is we can look at how changes in tree canopy affect mortality. So did mortality change over time, rather than just over the whole study area, 15 years? We can look at these neighborhoods and say, well, this neighborhood here saw a change in tree canopy characteristics. Was there more mortality? Which was important, as I was mentioning before, as we have a new subdivision that goes in. They clear the ground, they put in new trees, and it may take 10, 15, 20 years before we start to see that protective effect. So these are some of the things we can tease out if we have more sensitive time slices of tree data. We of course want to work with more with different spatial units. Unfortunately, the health data is supplied at a postal code level, so there's only so much you can do with that, of course. But we could aggregate up to other units such as dissemination areas or census tracts. And then if we do that, then we can incorporate demographic parameters as well. It's difficult to get this data at postal code level, but if you change it to dissemination area using that PCCF file or aggregate up, then you can incorporate Statistics Canada demographic information that you don't have to collect yourself. It's freely available, and you can use that as a controlling factor. We definitely want to look at more time-sensitive data as well. So these are mortality cases, but it doesn't necessarily always correlate to when the person was exposed. They may be over time in their neighborhood, there is an accumulation of exposure, but it doesn't necessarily tease out in all cases the specific time that the person had this health event. So looking at something like 911 call data, we could get definitely more time-sensitive response, and we could definitely get more spatially resolved as well. So where did this event occur specifically? Maybe it wasn't even at their house. Maybe it was when they were out for a walk or something like that, or when they're at the mall or something. So this type of data is important because we can figure out where the exposure was and when the exposure was, rather than relying on this kind of coarser data set. And we definitely want to incorporate more environmental data. So air quality data is something we're going to use next. Heat index, so potentially humidex, and since we're in Canada, humidex would be good to use because that's obviously important, where higher humidex is going to be a better predictor of mortality than just temperature. And there's other options as well, such as spatial synoptic classifications, which look at the type of weather that's going on. So incorporates things such as pressure, humidity, temperature, to see what is the perceived temperature going on, how oppressive is the current weather regime, and that might be a better predictor than just raw temperatures in looking at mortality. Yep, so just some acknowledgements, just thanking the overall funding for the group, the University of Montreal, which is part of the group that did the LiDAR, and Housing, which is my research group as well. And yeah, and you guys for listening. So thank you very much.